Good evening and welcome to this episode 31 of our From the Horse's Mouth podcast, where tonight we are discussing getting stretched for success. What does an equine physiotherapist do? Whether your horse is a leisure or performance horse, the therapeutic purpose of veterinary physiotherapy treatment is to promote musculoskeletal health and physiological well-being in order to allow for improved suppleness and extensibility of movement in all equine athletes. So tonight, thank you, Sasha Chelin, for joining us. Who's going to discuss with us all of the questions that we might have. I want to remind you that if you've just joined in, that you can leave your questions in the comments section. Sasha, thanks for coming to chat to us.
Sure, George.
So, Sasha, do you want to lead off by telling us a little bit about yourself? And you're obviously an equestrian yourself, and how you combine two of those passions.
Yeah, so a junior, I was a 135 show jumper. And my parents kind of said to me, well, you can't ride horses for the rest of your life. So I decided I wanted to go and study physiotherapy. And once I qualified as a human physiotherapist, I then did a postgrad into animals, hence equine physiotherapist.
For now.
So I've been practicing now for actually it's 11 years now. Can you believe it? So I graduated in 2012 and pretty much did my postgrad straight away. And so I've been doing horses probably about 9 years and humans for 11 years.
So horses must be significantly harder to do than people because, as the vets also know, you don't have a patient that can always communicate with you as easily.
Yeah, look, you get good at watching movement, watching slight cues. I did watch your podcast with Susan and all her little cues on pain. And that's basically how we kind of work out what's wrong with them. And obviously lameness and subtle lamenesses come in handy when you're a physiotherapist, because they don't often call you when the horse is crippled. But obviously when there's a drop in performance, they're going to call you.
And that's often an indicator, right? Is that there's just this performance. So that's the first cue for owners that something subclinical might be brewing.
Yeah, look, the physio is generally cheaper than the vet. So owners tend to phone you, even in a crisis, as a first point of call. Can you fix their horse? Because I think in the financial climate that we're in, owners are very cost conscious. And so they tend to try and get the physio to fix the horse maybe before the vet has a look at it. Sometimes it's just a drop in performance, and sometimes the horse is really, really sore, and you actually end up saying to them, look, you need to get a veterinarian involved, and then come back to me at a later stage.
And so how important is it to have a physio that can work well with your vet? I mean, do you have to work extensively with the other team members of managing a horse?
No, technically, as physios under veterinary council,
I didn't know that, really.
Yeah, we are now under veterinary council. So of recent, we've now registered with veterinary council. And so under veterinary council rules, technically speaking, a physio in the equine industry, unlike with humans, is not a first-line practitioner. So technically speaking, you do need a referral from a veterinarian to work on horse. And most of my vets have a kind of a loose kind of agreement with me. They kind of trust my judgment that I'm going to refer to them when and as needed. And I kind of carry on my work underneath them. So it's really, really important that you have a good working relationship with the whole team, not just the vet, the farrier, the saddle fitter, everyone.
I think it was really interesting. We spoke to a great international farrier a while ago called Stephen O'Grady, and he said that it's really important for there to be this holistic team and that no one's out there to beat anyone else up, but we are all hopefully working together and remembering that our ultimate patient is the horse. and that it's for the best of them.
Yeah. Something interesting that I kind of learned, like when I was working in the hospital before I even started horses, the one nurse actually said to me the one day, I think the doctor was fighting with the other doctor, and she said, guys, you got to remember, we're here for patients. And if we are not doing good by our patient, then actually we're failing as professionals, and we need to stop bickering between one another and trying to have God complexes and just be there for the patient. And that's basically what we need to do for the horse as the rider, the owner, the coach, the farrier, the physio, the vet, everyone.
So, Sash, that's maybe a good segue for us to discuss what kind of pathologies, behaviors, and conditions can be assisted by physiotherapy in horses.
So I think there's 3 areas you've got to look with physios. There's all the preventative stuff. So basically, from a musculoskeletal point of view, we look at body imbalances and stretching those out and kind of loosening up muscles that may cause a problem later down in the line because the horse can't use the right side of its body, or the right hind is not coming enough through. So that's the one area. And then the next area is stuff like kissing spine. We do a lot of rehab with kissing spine and sore backs and bad fitting saddles, necks, bad injections that have gone wrong and the horse has a big hematoma. Physios do a lot of work with that. Lymph drainage, so any type of swelling, we come in and we get all of that lymph moving and the swelling to kind of move off. And then you've got to look at like a more of a rehab further down the line kind of injury, like a suspensory where the horse is rested for a while. And then we come in at a later stage and start with some shockwave or some exercise prescription. I think that's one area that we're severely underutilized in the equine.
Is that
sorry?
Exercise
prescription? Yeah. So the vet often give you your program of 10 minutes walk, 1 minute trot on a hard surface, and you kind of integrate that. But I think what people forget, especially when going back to competition, is that once the horse has started working in the arena, once the horse has gone back to the kind of doing some endurance work or whatever the horse was doing before, they kind of just leave you on your own. But you've got to keep rehabbing. If that horse was like an elementary dressage horse or an advanced dressage horse, you can't just go back straight to advanced. You've actually got to break down all those dressage movements or all the jumping techniques to get back to where you were. And that's where the physio comes in handy, because we actually are able to isolate all those movements and say, like, start with this or start with that first, in order that you don't go backwards or you don't re-injure the horse. And I think it's really, really underutilized.
Absolutely. And I see there's quite a lot of, I remember, that's how old I am, that, you used to do box rest extensively with horses previously in rehab programs, and they've moved away from that completely now, where now this controlled movement is so essential to minimizing scar tissue and maximizing that. So I'm really glad to hear you say that. I think it's really interesting. What are cues for owners who haven't got an obvious injury? And I'm talking more about behavior, and for people who maybe haven't watched the Sue Dyson podcast, what are some of the cues for them that they should consider getting a physiotherapist to maybe come have a look at their horse?
So you'll see often change in behavior when you're tacking up. I think it's really important that even though in this country we tend to have our grooms tack up, that you do actually go and have a squiz at what happens when your horse gets tacked up. What happens when the groom puts the saddle on? What happens when you do up the girth? Does the horse put its ears back? Does it switch its tail? Does it not want to stand still properly? And then really like subtle drop in performance is an indication for physio. To the other extreme, where I had a horse today who I saw where the owner was like, he just doesn't want to move forward anymore. And yeah, that's not wanting to move forward or not being happy in any kind of work, I think is an indication for us to get involved and see what's actually happening.
I think it's really lovely. And I think Sue Dyson can obviously be partly credited with this, but this movement away from, oh, my horse is being naughty, or it's being a jerk, or it hates me, or it's spiteful, to going, this is an indicator that there's a problem that we have to have a look at. And, I think always persevering slightly through an issue, but then ultimately having a relationship with a physical professional who can come and have a look at a horse is absolutely essential. So what are some of the treatments that physios offer horses? What does like a session look like? And I know that there's a wide variety. If you can just maybe run us through some of them, Sash.
So generally what happens is I come and see your horse. I'll have a quick palpation through your horse, have a quick feel of what's going on, and have a chat to you. What's going on? What are you finding in the work? At this point, this is not the time to hide stuff from your therapist. I find a lot of people try and like catch you out. Well, can you find the problem? Well, yes, I probably will find the problem 3 sessions down the line. It would be just easier if you told me exactly what's going on with the horse and give me as much information as possible. And then when you're looking at treatments, there's a wide variety of treatments. From electrotherapy, under the electrotherapy bracket, we have TENS, therapeutic machine. You've got ultrasound underneath there. So ultrasound is really great for swellings and that kind of thing, and scar tissue.
Could you take us through each of those and just very briefly discuss what each machine would do?
Okay, so if you're looking at shockwave is like the new buzzword. Shockwave is used for ligaments, kissing spine, so like your chronic suspensory ligaments. Shockwave is great for that. So anything that is pretty much a ligament or soft tissue injury that's chronic. So like your kissing spine ligament, your suspensories, even an old glute tear that has a little bit of scar tissue in. And then we have physiotherapy. Now, physiotherapy is quite an old machine. We've been using it for quite some time. It helps loosen up muscles. It also can give you an indication of where the horse is tight, because the pulse of the physiotherapy machine actually slows down and the amplitude becomes smaller. So yeah, it is. While it is a treatment tool that we use, it can also be a little bit of a diagnostic kind of.
That's great. So you'll actually see a muscle's less reactive to physiotherapy if there's an issue. Okay.
Yeah. And then we've got ultrasound. Ultrasound we use, it's also an old modality we use on acute kind of injuries. So it's great on the horse's bump itself and has a swelling. The vet's given it an injection and has a hematoma now. Ultrasound is great for those kind of things. It can break down a little bit of scar tissue, but we prefer now to use maybe like something like the shockwave machine. Then we have TENS. I'm not a huge fan of TENS because I feel that it's very short-lived. And a lot of owners actually do their own TENS work now. Some of the physios have trained owners to use the TENS machine.
What is TENS?
So TENS is those little sticky pads that you can pop on the horse, and they kind of stimulate the muscle. You get different programs on the machine. They're really cheap machines. You've often seen them in the Verimark ad, get some abs, and they like
butterfly abs.
Yeah, exactly.
I remember asking my physio at the time, I said, why can't I just put that on my abs and sleep in it? Like every night, and then surely I'll just like in 6 weeks, I'll wake up with a 6-pack. And I'll never forget her saying to me, she said, if that worked, like people would be using it. I would be driving a Ferrari. It wouldn't be on very long.
Exactly. So, so I'm personally, I'm not a huge fan of TENS, but each their own. It has its place.
Why would you use TENS instead of a physiotherapy machine, Sash, out of interest?
So a physiotherapy machine is quite deep. and some horses don't like that. So then you might opt for 10s. 10s is also much safer for your owners to kind of use themselves. So if you want to train your owners to use them, as a phoretic machine, you can actually rupture muscles and do quite a lot of damage if you don't know what you're doing, or tire a muscle out completely if you don't know what you're doing with it. So 10s is a much safer modality. Some of the horses don't like phoretic, and then you've got to use something else. So yeah, that's pretty much your electrotherapy brackets. And then you've got your hands-on therapies. So your massage, myofascial release. Myofascial release is a big craze word at the moment. You get these therapists that are myofascial release specialists. Well, physios have been doing myofascial release for as long as I can remember. So if you have a physio, your physio is probably incorporating that into your session. You don't need to get a separate person to come do myofascial release. But that's basically just releasing all the connective tissue that runs in between the muscles. So we often use it in conjunction with massage. And then you've got your mobilization techniques. And your mobilization is where we're actually getting the joint to move and loosening up all of those joints. So you'll often see a physio moving their hands, moving all the vertebrae down the horse's back, or you move the horse's neck, and you are mobilizing that neck vertebra, knees, hocks, all of that. We can mobilize pretty much any joint. So that's mobilization. And then you've got the K-tape. So you can K-tape horses and tape horses.
Kinetic, is it kinetic tape or kinesiology tape? Okay.
Same thing, yeah.
Can
So there are various tapes that you can use. So you can use the dynamic tape as well, which just stretches in 4 directions instead of 2 directions. Interesting to note, FEI events, you are not allowed to tape the horse and work the horse in the warm-up arena or in competition. So you may tape the horse in the stable yard, but as soon as you have someone on the horse, the tape has to come off. So
that's
just
a pretty good indicator that it's quite effective, I think.
Yeah, look, FEI has got quite strict about quite a lot of the modalities. I'm sure we'll go through what we can and what we can't do at a later stage. But yeah, it works great for swelling. Like tape can bring down swelling really, really quick, and you can use it as a proprioceptive technique. So meaning joint awareness. So you have some horses that are just a bit like sluggish to come through on the hind leg, and you're struggling to strengthen up a certain muscle group. It gives them a little bit of awareness that they need to kind of use that muscle group. So you can use it in that regard. And then obviously you can use it for a little bit of support for something that's injured and you just want to protect for a little bit, but you don't want the horse to stand and do no work. So, yeah.
And the only other thing I'm interested to hear about is dry needling. Is dry needling still a popular?
Yeah, dry needling is. Not many physios are actually qualified in it.
It's a standalone speciality almost.
Yeah, so you actually have to go and do further training after your studies to do it. So your average physio won't be doing dry needling. So just check that whoever is doing dry needling on your horse does have some sort of training in it, because obviously it can also go
quite wrong.
Patient. Yeah, exactly. But it's very, very effective. Basically, how that works is you pop the needle into the muscle where the spasm is, and that causes a little bit of micro trauma, and you get a rush of blood flow there for healing. And you often get a little jump where the muscle releases, and you break down that spasm with the needle. So it works really well, and it works really well in sensitive horses that don't want a lot of hands-on therapy.
I'm trying to think where the best place is to slot this in, but of course any professional rider, I think, is listening to the treatments that you've mentioned, and they've had these treatments done to themselves. How important is the physio to work with for equestrian riders, for equestrian athletes themselves? I mean, it sounds like there's just an amazing variety of benefits that riders need to be aware of physically.
Yeah, completely. So I work with a lot of riders. I treat a lot of riders and their horses, and it's quite interesting the problems that they often have, their horses have. So it's an interesting dynamic to work with, because sometimes you fix the rider and then you end up fixing the horse just by fixing the rider. And sometimes by fixing the rider, you actually help the horse along a little bit, because now, you know, the rider's hip was jammed, and now they can help give it a little bit more support with their leg, or their aids are a little bit quicker. And so the horse benefits. And it's quite interesting treating both. There are not that many physios that do both, but it's a really interesting dynamic. And I think it's really, really beneficial for both rider and horse. You know, a lot of broken riders, so many times I hear, oh, my horse gets all the pampering sessions. I haven't seen a physio for months and months and months. We tend to spend all our money on our horses and no money on ourselves. But sometimes we actually need to spend some money on ourselves in order to fix our horses.
I think that's really, I mean, if you, like you're just saying, how important this live weight is. And I've got a small child. Anyone who's carried around a small child knows that it is carrying a screaming, kicking person, as opposed to somebody who wants to be carried, is very different. So I can only imagine how it feels for the horses. So is it possible to find physios who creates like programs for the horse and for the rider?
Yeah, so really interesting. Just before COVID, we were really lucky to have a physio from the UK out called Andy Thomas. And he developed, or has developed, a whole lot of screening stuff that we can do. And I actually work with a lot of riders where we actually do a rider assessment, and then we give them exercises on their horses, because my riders don't like to do exercises or on the ground. They're really bad at the exercises on the ground. If you give them stuff, if you give them stuff to incorporate while they're doing their flat work, the show jumpers or the dressage guys while they're doing their warm-ups, they tend to be a lot more compliant. And yeah, they tend to fix a lot of issues that their coaches have been screaming at them for months and months and months. And often it's not necessarily that they're not listening to their coach, it's just their body actually physically can't do it, or they're compensating. And if they stop compensating and they put their leg in a position where their coach wants it, they're actually going to like fall off their horse, or they feel unbalanced, unseated. And if you correct those balances and you give them a program, they actually do much better in their lessons and their coaching sessions.
That makes sense. I think horses and riders similarly don't want to do the wrong thing. Would love to do the right thing. We just need to sometimes be physically conditioned in order to do that.
Yeah.
So Sash, you mentioned the dry needling earlier on as one of these things. What are some of the things owners need to be aware of when choosing a physiotherapist?
Yeah, it's a big problem that we've had now with council. They've kind of lumped all of us therapists into one lump sum category. And I often find owners think that they're having a physio come out, they're actually having a body worker come out, or they're having a myofascial release specialist, and not actually having physio. So you've got to be really careful who you get out, that your person that you are getting out is qualified, that they are registered with Vet Council, because then at least you have some recourse, God forbid something should go wrong. And especially for like the high-end modalities like shockwave, you can do a lot of damage if you're not an accredited person doing the modality. So yeah, I think checking Vet Council that your therapist is registered, they've done their homework, that the person qualified, I think is one thing. And then, you know, trying to get a therapist that has a lot, that's, if they're a physiotherapist, they'll be trained in a lot of modalities. So they'll be able to give your horse not a one-stop treatment. They'll be able to tailor the treatment that best suits your horse and its needs. One horse is not similar to another horse, so you might need to do more soft tissue work on that horse, or more electrotherapy on another horse, or more stretching work on another one. It just depends. So getting someone that's qualified in quite a number of modalities is a good indication that they probably are a physiotherapist.
I think it also just sometimes helps, not to be a jack of all trades, master of none, but having more tools to offer makes sure that you can really find the correct tool for the appropriate pathology, I think.
Yeah.
Can we briefly discuss, and I know this is like asking you how long is a piece of string, but what is the optimal kind of physio treatment regimes that you would create for rehabilitating a horse, optimizing a horse physically, and then also for a competition horse? And kind of what I'm looking for here, Sash, is like, how often should each of these three horses be seeing a physiotherapist? What kind of a role would you play there? And I would also like you just to maybe briefly talk about the role that owners have to play in the physical rehabilitation of these. Obviously, the physio drives it, but that owners do need to do the work in between.
Yeah. So I think for acute injuries, if it is where we are now stepping in an acute injury, whether it's a suspensory or whether it's a kiss and spine case now, we generally try and do once a week for a few weeks, that we just hold your hand a little bit, that we do all our hands-on therapies before we just give you an exercise prescription and we send you off on your way. So that we normally do like maybe once a week for a couple of weeks, and then we taper off like that. If you are looking at a hack horse, or you're doing low-level competition, low-level, I mean prelim, novice dressage, 90 centimeter show jumping, a meter show jumping, short endurance rides, hacking up, that kind of thing. I think getting your horse checked out once every 2 months or once every 3 months is a good indication. And then your high-end level sport horses, my horses that I treat that are jumping in like the open levels, my high-end dressage horses, they get seen at least once a month, if not before every competition or after every competition. It just really depends on the horse. Some horses benefit from physio in between a really build up to a competition, like tight training regime coming up to a competition, and then we treat them in between when they start tapering off just before the comp and they go to the show. And some horses need to be seen after the show, and they really struggle after the show. And some horses, if it's a long show, actually get seen during the show. But then again, you've got to tailor your physio sessions accordingly, because I generally like to tell owners, like, please give your horse a day off the next day, or please like lower the work the next day. Because I mean, you know what you feel like when you go to the physio or the chiro or anything. You feel like terrible before you feel better, So you don't want to be working them too hard. So if we do treat them through the show, we have to adjust our therapy sessions accordingly, so that next day the horse actually feels good.
And again, I suppose it's important for the owners to communicate this effectively with you, and to say, my horse has to compete tomorrow, and then you might elect to even not work on a horse, perhaps.
Yeah, precisely. I mean, during competition, I have one rule. If I haven't worked on your horse, I don't really want to be working on it, because I don't know what I'm doing to it, and I don't want to cause you not to have a good show. The shows are so expensive. You've gone to the show, and now you want to do well, and I sometimes think owners do too much during the show. Greg Scott always laughs at me when he sees me at the shows, and he goes, "Oh, are people cramming again? They're cramming, doing last minute homework."
Love that.
So yeah, sometimes when you get to the show, it's too late. You should have been doing all of this stuff a week before, Yeah, and then the last thing to kind of touch on in your previous question is that please, your exercise physio gave you. I mean, there's a reason that we're giving you physio exercises and prescribing you all of this. It's kind of like going to the doctor. You pick up your script, but you never go to the pharmacist and go and collect your meds, or you never take your antibiotics. Your exercises are actually your medicine.
Oh, I love that. That's such a great way of looking at it. I really enjoy that. Um, Sasha, when it comes to shows, what is competition legal besides what is suggested by you? And again, I'm aware that obviously horses are the ultimate variable. So who knows? You know, one horse might benefit from seeing you and one other might not. But I know that there was recently great panic around shockwave being illegal to be administered over a competition show. Can you tell us more about that?
Yeah, so FEI have now put a ban on shockwave 5 days before competition. So you are not allowed to shockwave a horse 5 days before competition of any competition, whether it's an FEI competition or just your local show, because any local show runs under FEI rules in terms of those kinds of things. And the reason for that is not because shockwave is bad or, people are panicking like, oh, it's a terrible modality. It's basically shockwave irritates the area and causes, one of the causes of irritation is an analgesic effect. And the FEI did not want horses to be shockwaved before a show with a low-grade injury, feel better with shockwave because now they have this analgesic effect and they're feeling really great, but they've got this low-grade injury, and then they go into competition and it's actually detrimental to them and they injure themselves in a catastrophe kind of way. So that's why they have banned it 5 days before competition, to make sure that any analgesic effect that you're having as a secondary effect to the shockwave, that's not what shockwave actually does. It's a secondary effect of it. That's out of the horse's system, and they can actually feel everything as they should be. And any low-grade injury is not then masked during the show. So that's one of the reasons.
And things like dry needling, is that legal to do, or is it recommended, or is it not recommended?
So dry needling, it is not allowed to do in secure stabling. As far as I'm aware, you can still do dry needling through the show as long as it's not an FEI event. So FEI events, only needles that are allowed to be put into the horse's skin are by the treating veterinarian. So no one else can put a needle into a horse's skin during that competition.
Not
And
even
that's
your
just
own.
basically, no. So the veterinarian on call, the show veterinarian, will do all your Traumeel or any of those kind of supplements that need to be injected at the show. So you hand those into the stewards, and then you organize with the show veterinarian for all of that kind of stuff to be done. So
And when it
yeah.
comes to physio over a show period, you said you would rather not see a horse for the first time. Like, please, people shouldn't be phoning a physio if the show's tomorrow and trying to, to patch things.
Yeah. Look, I have a group of horses that I do see during shows, but I know all of them really, really well. I know exactly how they're going to react if I mobilize them. I know what they're going to do if I do electrotherapy on them. So if I Ferratic them or pop a TENS machine on, I know exactly like how they're going to react to it. So I've actually got a list of horses that for Take a World Cup, they've got a day off, normally on a Saturday. And so some of them who get like a little bit body sore, we actually see straight after competition on the Friday, so that they have the whole of the Saturday to recover before they have to jump on the Sunday again. And some horses are actually fine with it, and I can treat them like the day before the show. I've got 2 horses that actually treat before competition. I give them a good stretch because they're really, really stiff. We call them the planks. And they respond really, really well to it. But you don't really want to be treating a horse that you don't know how they're going to react to, and they feel really, really terrible the next day. And you're trying to jump this poor animal that's now feeling really sorry for itself. Yeah.
So my
So
takeaway from
that's,
you there is basically we should be creating a long-term relationship with a physiotherapist so that if you want to call on them during a show, you can. But they need to be able to know,
yeah.
and they need to know how it responds.
Yeah. So my clients, I generally travel with them to the show. If I can't travel with them to the show, I have a network of therapists, and then basically what happens is I will phone that therapist and we will discuss from A to Z on what works well for them, how they respond, where I generally find the problems, what the riders generally find, and how they should proceed. And then I hand my patient over to them so they can look after them during the show if they need anything, and at least then they've had a full handover on everything. But getting a horse that you don't know anything about, it's quite hard to treat them during a show and know that they're going to be okay.
Sasha, you mentioned Promeal earlier on. What are some supplements or at-home treatments or at-home therapies that you like that owners can safely use without too much alarm?
Look, I am a great believer in Beamer. I never thought I would be, but I've done a lot of research on like the Beamer kind of products. They relax the horses. So if you have an anxious horse, they relax them.
They relax
Really,
riders too.
yeah, no, they do. I think if you relax, the horse is relaxed.
Yeah.
Yeah. So the Beamer that is really, really safe to do. Has all its programs. It runs. It's FEI legal. It's great. You can carry on being your horse. Obviously, I'm a big believer in ice after competition. Quite like that. My big rugby players get into these ice baths.
Yeah.
after
It's funny how we keep coming back to these, I want to say like old-fashioned remedies, but I see
yeah.
there's if anyone's into social media the way I'm in, there's like a big TikTok ice bath movement where people have been doing like 30-day ice bath challenges and tracking their wellness elements, and definitely for legs. And I think show jumpers have never gone away from ice, and event riders, I think they've been committed the whole way through.
Yeah. So so I really, really like ice. One thing though to note, if your eye not legal to drop below 0. So any cryotherapy, so any ice therapy that is dropping below 0, you're not allowed to do 5 days before competition. So just a heads up on that. Yeah. So, but ice away, I think it's you just got to be careful that you're not burning the horse's skin. So even like those big boots that they shove ice in, put in some water in with that, so that it doesn't burn your horse's skin. But yeah, big believer in ice. Look, there are so many kind of supplements and what should be using. I think you need to try and figure out, as hard as it may be, what works for your horse and what doesn't work for your horse. And if it is really, really, really working, or is it just making you feel better? Because
the Dumbo effect. I think we're all here for it. We're all looking for a feather to hold onto that makes us feel like we can fly.
Yeah, exactly. So, without going over too many brands, there are a ton of brands that have now come up with a whole bunch of powders you can put in their food for recovery. You've got injectables that make them feel good.
Sasha, and I don't know if you're the right person to answer this, instead of looking at like a brand name for a recovery product, what are elements of recovering a muscle? Like, should we be looking at basically like hydrating the horse, making sure it gets protein into it? Like, what are the elements of that?
I always believe if horse is fit. Fitness is a big thing. That you are keeping the horse hydrated, so electrolytes, and that you are walking them, especially if you're at a weigh show. Don't leave the horse in the box. Make sure that you are a good owner and you are walking them a lot, that they're getting a lot of movement, and that they have a really, really good quality diet. You shouldn't have to need too many other supplements to keep your horse happy.
Absolutely.
Yeah.
You spoke earlier on about owners who sometimes don't give you all the information. What are some of the other pet peeves that physiotherapists have about owners, and how can we be better owners?
Yeah, so I think so communicating well with the therapist is always key. Letting them have all the information. If you feel the need to make your therapist sign an NDA, let them sign an NDA, let them talk to your team. Don't try and hide the team from them. We need to work as a team, and it's best when we're working as a team that we can communicate with one another and look at scans, look at x-rays together, chat about that kind of thing. I have a few owners that, always worried that if they sell the horse later on down the line, that maybe the injury will come out. A good professional is not going to go around town telling everyone that your horse has an injury. But being able to talk to your veterinarian at the extent of the injury and what's going on, or the farrier, about changing maybe the shoes or changing the feet angles because now we've got a shoulder injury, is really, really important. So being able to communicate with your whole team. And I think listening to your therapist, like really, really, really try and listen to your therapist. Yes, we need to work together and I need to listen to them, like as the riders. I know that's always their pet peeve, is that some professionals kind of float above their heads and kind of treat them as, lack of a better word, idiots. But yeah, so we have to communicate together, and if the rider can listen to you and do the warm up and do the cool down, and do the stretches and do the homework, it works much better.
I do have a question here coming through, Sasha. You mentioned Traumeal. Someone says, what is the ideal way to use Traumeal for your horse?
Look, I'm not a vet, so this is a little bit out of my scope of practice. But so I do have some clients that do inject it, IV. Obviously, remember, need the vet to do that. They can ingest it as well, so you can put it in a horse's food as well. So you can do either or. You've got some people that just inject it subcutaneously as well. But I think the fastest route to do it is to get your vet to do it IV. And it's the most effective, quickest route to get it around the body.
Okay.
Yeah.
How do you qualify to become an equine physiotherapist? You obviously mentioned that you had to go the human route first. What is the pathway like from, like, if you were speaking to a high school student, what do they need to do from this point on?
Look, I think nowadays there's two routes to go, and you really need to decide whether you want to do humans as well or whether you don't. I didn't have that choice. There is now a college offering a four-year degree that you can do, and then you just qualify on animal physiotherapy as a whole. Or you can go and do an undergrad of a B.Sc Physiotherapy or a bachelor in physiotherapy at, I think there's 5 institutions that you can go and do that as a human physio, and then do a postgrad into horses if you want. So yeah, I think those are the two routes that you can take. I'm obviously biased. I think treating people has made me a better horse physio, and treating horses has made me a better human physio.
I think
So
it's lovely, especially when you're dealing with horses who the rider is such a massive. And I remember that Andy Thomas, it would actually be great to speak to him, that Andy Thomas series of clinics that he did. I mean, it was phenomenal. Like I have seldom seen something. Kinetic shaping is one of the other things out of interest that you see a change within 5 minutes. And I was
yeah,
fascinated to see the changes that made just in the rider, not touching the horse, the effect that it had on the animal at the end of the day. So I think having a foot in both is, I mean, I can't say that it's essential, but it's certainly very valuable.
yeah. Look, I mean, Andy is phenomenal at what he does, and there are about 4 or 5 other therapists that I keep in touch with around the world that are doing like phenomenal things like what Andy's done. And I really think sometimes when you're struggling to fix the horse, you sometimes need to actually think outside the box and don't even look at the horse, look at the rider, because that's the only other influence the horse is having. And the horses you get those horses that been to the vet, they've had the 5-stage lameness workup done on them. The vet can't find anything, but this horse is still poor performing. And then you need to actually look at the rider. We don't like to look at ourselves all the time.
No, but I mean, isn't it just such a sport of introspection? It's basically if anything's going wrong with your horse, it's your fault because you're either feeding it wrong, you're saddling it up wrong, you're handling it wrong. It's always our fault. It's really great.
Yeah.
Very good. Sash, just to wind off, what you mentioned walking earlier on, you said like the owners have to walk and they have to do the exercises. What are 3 things that every horse owner could argumentatively do tomorrow to start physically optimizing their horses? Everyone loves to talk about like carrot stretches. That was a big thing. And I think like we find that a lot of fun. I don't know how effective they are.
Yeah, I think carrot stretches have their place. You kind of make the horse into a little bit of a trick pony. They start doing the stretch before you even give them the carrot. But I think if looking at the way the sport is moving and how we need to start changing things up, I think the one thing that riders are really good at warming their horses up, but they're really terrible at cooling them down. And I think we need to focus on cooling our horses down, especially in competition. I think it's really difficult, especially with our professionals, when you've got 6 horses at the show and 3 in the same class, and you're hopping from one horse to the next, and that poor horse just gets put back in the horse box or the truck and waits to go home. And yeah, the groom or you need to walk that horse for at least 10 minutes. And even when you're working at home, you should be cooling your horse down. And that doesn't just mean walking them. That means, going from the canter to the trot back down into the walk as you've warmed up and taking your time and warming down all those muscles so that you don't have a problem tomorrow when they're stiff because they haven't been cooled down properly or they have an injury. So I think that is one thing. Another thing is just listening to your horse. I think Sue Dyson's thing has really kind of really highlighted what we should be looking out for in our horses and calling them professionals at the right time. The physio can't work miracles on your horse, and sometimes you actually do need to spend money on the vet or the farrier. So I think that's one thing. And then the other thing is checking your horse before you get on and when you get off. Yeah, checking them up and down and actually feeling the tendons and feeling all the little bumps on them, because then you're going to catch injuries much quicker. You should know what your horse's back feels like. And then, it changes from day to day. I mean, oh, yes, 2 days now, my horse is being really reactive when I put my hand down its back. Maybe I need to get my saddle fitter out. And when was the last time I got my saddle fitter out? Well, oh, goodness, it's been a year and I'm actually due. Yeah. So I think I think like actually feeling your horses and running your hands down them and knowing what is normal for them and what's not normal. I had a client about 2 weeks ago, and walked into the stable, and oh my goodness, the leg was like so swollen. And I actually said to her, "Is this normal for your horse?" And she kind of got deer in headlights and didn't know how to answer me. And thank goodness groom was there. And he was like, yeah, she does this from time to time. She's being in the box all day and the leg actually gets puffy. So that's normal. Don't freak out on that.
Yeah, Sasha, I think you said it earlier on, we're so spoilt in South Africa with the wonderful grooms that we have, and they're so involved. I think it's essential though for the riders to be more mindful of that. And professional riders are often, I say that as myself, it's often you arrive and the horse is tucked up at the mounting block and you don't even know what the boot's gone over on the leg. So being mindful of that, and the top riders are, like I know Dominique, for example, knows you could take any one of his horses out of the stable and he can look at the leg and go, no, that bump's been there forever, or no, that's new. But as you say, it's having that base of comparison that's so crucial.
Yeah.
Sasha, is there... No, sorry?
And subtle, you often get like a really, really subtle swelling or something, or subtle heat. That's your first indication that there's a problem and an injury. And, getting those sorted out as quick as possible is always shortens your rehab time. And it can really, really, really stop a major injury from happening.
Yeah. There's an international vet who called Henk Offrens, and I really loved, he said ages ago that when owners come to him and they say their horse just isn't right, they don't know what it is, because he said that's the first sign that there's a subclinical injury waiting to pop. And that's the time you hopefully want to catch it. You don't want it to progress or like work through it. Obviously, some things, do have to be pushed through. Sasha, is there anything else that you would like to add to that? You've been so knowledgeable and helpful.
I think as owners, we really, if I think about what we're doing for our horses these days, sure, we've got lucky horses because our horses are really being looked after. And we just need to continue doing it and being more aware and more there for the horse. I think that's the take-home message, is that they are, we really, really, really need to be aware of what's going on with them. But I think we're moving in the right
direction. Better for them.
Yeah.
Okay. No, I love that. Thank you so much for your time this evening. It's been really great chatting to you. And I'm sure we'll be speaking to you again at some point about physiotherapy version 2.
Yeah, perfect. Thanks for having me.
Thank you. Such a pleasure. If you've just joined us, this was episode 31 of the South African Equestrian Federation's podcast From the Horse's Mouth, where we were very lucky to chat to Sasha Chelin, B.Sc Physiotherapy, about how you can get stretched for success. Please make sure to join us next week, Wednesday, again at 7 p.m. Were you stressed out?